Casey Metcalf, who is joining us as the mandated dentist on the board. So very happy that you are with us, Dr. Metcalf, and looking forward to our collaborations with you.
Thank you.
So we will review and take action on the board agenda. Before we vote, I want to point out that I would like to make an amendment and add item 6B, which is a review and vote on the board's letter to the commissioners that Stoney sent out earlier this week, and we hope to discuss that, vote on it, and send it to the commission after our meeting. So with that amendment, and after your review of the agenda, I will entertain a motion and a second to approve.
So moved. This is Leanne.
Thank you,
Linda,
Leanne.
I'll second.
Thank you, Linda. All those
Lucy,
in favor?
Before we vote, I just had one clarification. The contentious idea of an oath is not on the agenda. Is that purposeful? Is that we're going to continue to delay that discussion?
That is purposeful.
Okay. Thank you.
Yeah, thank you. All those in favor?
Aye.
Aye.
Any opposed? Thank you. We will move forward with our agenda with our amendment. In accordance with State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance of conflict. Our next agenda item is review and action of the April 2024 board minutes, and I hope folks have had the opportunity to review, and once ready, I will accept a motion and a second to approve.
So I don't see anything in the minutes about Stoney's discussion on his concerns for safety.
I'll go back and add this.
Krista will go back in and make those amendments.
Because I think there was a good discussion about concerns for safety for the Buncombe for the health department's facility, and concerns about that and how to potentially address those in what manner.
Yes, thank you, Dan. And the result of that is the letter that we are going to be discussing.
Right, which is what that's what we asked for.
So we will make that amendment. If folks don't need additional time, I will entertain a motion and a second to approve the board minutes from April with the revision around our discussion related to safety at 40 Cox Avenue.
So moved.
Thank you, Dan. Your second? Thank you,
Linda, I'll
Johnny.
second. Oh, okay.
All those in favor?
Aye.
Any opposed? All right, thank you so much. The board minutes with the amendment are approved. Next, we are going to have our committee updates, and we will begin with Health Committee. And Dick, I think you are going to share some great information.
Yes, this is we had a continuation of the discussion that we presented to the general board, I believe, the month before last, of Dr. Shukla's proposal for smoking supply distribution for harm reduction. That we had listed 4 topics, of which 2 were mildly contentious, and he was there to discuss this with us. And also we had in attendance Justin Scheidel, who was a harm reduction coordinator and peer support. And we had a discussion in the general board, and Dr. Shukla talked to us about our question of whether the risk of addiction is greater in IV drug use than smoking, which seemed to have been bandied about in the MMWR of February 15th, 2024. And in spite of what was written, that Dr. Shukla assures us that the addiction is greater in IV drug use because this is what he does for his expertise. The other point that we discussed quite a bit was whether this program has a value to the community, or should we direct our resources toward other programs. And we discussed how valuable the smoking supply distribution for arms reduction could be valuable to the community. And we actually compared this with the SSP program for syringe support program. And we went over the fact that there are metrics to support the SSP program, and we emphasized using similar metrics in the smoking supply distribution program. So after talking about this, our committee had a unanimous support for Dr. Shukla's 3-month pilot program. That we think that it's something that's important because it will bring equitable access to these supplies similar to the SSP program, that we emphasize that it's important to have similar metrics to follow, although we realize that the metrics might not show us much if we look at them at the 3-month mark at the end of the pilot study. But the goal of this pilot program is to have us reevaluate it at a later date. We had suggested 6 months from now with further presentation to the general board, because they would like this to be a renewable program. And if and when it's renewed, they promise to follow proper public health essentials and reevaluate the program and pivot and adapt as needed. So the recording stopped and I stopped too.
I'm just, thanks, Dick. I'll just put in one clarification, is that Justin and potentially Dr. Shukla will come back to the Health Committee with presentation related to how the pilot is progressing within the SSP program.
are there any questions for Ellis or Dick or other members of the Health Committee?
Hi, this is Martha, and I would like to ask Ellis and Dick, if it's possible for members of other committees who are not on the Health Committee to sit in on the report when it becomes available.
Absolutely. We would love to have you join us.
Thank you, Ellis.
Dr. Needleman, I just want to clarify, is the Health Committee bringing a motion to the full board that the board recommend the establishment of a smoking supplies program as a part of our SSP? Is this coming as a formal recommendation from the committee to the full board? If so, I think that the update should come to the full board as well. Or I guess I just wanted to clarify that, since our process is usually that committees will bring things to the board for full board consideration. I just want to clarify to make sure that I understand.
I understand, and I'm glad you asked that question, because about 20 minutes ago, I asked the same question to Ellis. And Ellis, I would like you to explain your answer.
Yes, and I could be wrong, but my understanding with this just being a pilot is we were seeking support from the Health Committee to move forward with the pilot, and that a pilot project within a program does not need board voting to move forward with a pilot program. I may have been wrong in my statement, and please correct me if I was wrong, Stoney.
Yeah. I think just as a point of clarity, statutorily, the full board can make recommendations to the agency to implement social programs. I think we'd be in funny ground if we allowed a subcommittee to make recommendations to the agency for, it just seemed like it would violate the statute a little bit. Our committees are to generate ideas, but actions really should always be actions of the full board. That our committee structure was designed to bring recommendations to the full board so those committees could vet them, because we have so many programs, it's hard for the full board to vet things. But I think our structures under our board operating procedures would suggest that committees bring recommendations to the full board, and then the full board advise the HHS to implement social programs. I believe that's what the statute would say. Kurt, please weigh in if I'm off base there.
No, I think that any type of recommendation needs to come from the full board. I mean, I think that the committees can make a recommendation to the board as to whether this is a good idea or not, but ultimately it would be the board that would render the final determination.
Okay, and I apologize, that was my mistake. I was thinking, since it's a pilot and not an implementation of a program, and that we were just identifying for support to move forward with a pilot. I totally hear what you're saying, and tell us how to proceed.
Oh, no worries at all. I want to make sure we're being true to our operating procedures and the general statute. So just for clarity, Dick, is the committee bringing that as an action to the board in the form of a motion?
Well, listening to what everybody just said and try to synthesize it as best I can, I believe that at our last general meeting when we presented this, that you did allude to the fact that we should have another discussion and maybe even put it on the agenda so everybody can prepare for the discussion. And since we were unaware, we could be happy to put it on the agenda maybe for next month, and we can maybe ask Dr. Shukla to join us, because I know we had a significant discussion the last time we opened it to general board discussion.
So I think just my opinion is that, like, I would be happy as a board member to hear your recommendation and say that sounds good, not necessarily have to re-vet your recommendation as a whole board. I think that's part of the efficiency of the subcommittee is like, you've done it. We get to ask questions of you guys. We don't need another presentation that you already heard. You know, I mean, I think we do need to have some efficiency in the process for moving things forward and not doing things twice. You know, so I think you can feel fully confident to bring a motion to the board without us hearing all of the information.
Well,
That would be
thank you,
my
Dan.
opinion.
Dan, can I just piggyback on that? This is Martha. As a point of information, when do projects taken up by different parts of HHS have to come before the board? Does every project that's associated with some kind of research need to come before the board?
No. The short answer is no. I can read you what in 153A 77, there is a list of sort of powers or duties of the Health and Human Service Board. I would think this falls under recommending the creation of a local human services program. That's one of your tasks, is that the board can make recommendations, assure compliance with laws, set fees, adopt local health regulations. Those are, just some of the duties. I'll be happy to copy them and post them in the chat.
Yeah. And Martha, where I would land on it is if it's an advisory situation. So like if we're looking at a family safety issue in the Family Safety Committee, and the board is advising the social work director, that doesn't have to come before the full board. But if the board wants to take an action that's described by statute, and creation of programs is an action, then that action should come from the full board and have the support of the full board. Whereas a committee couldn't establish, take an action in and of itself because it's only a portion of the board. That, to me, it's about whether you're voting on something. So a good example is when the board has sent advocacy letters in the past, a committee should not send an advocacy letter. That should come before the full board and have the support of the full board. When we initiated that initiative around youth suicide, an idea like that might generate in a program committee, but you'd want the full board to vote on that because we actually hosted an event, a community-wide event, and we sponsored it out of the board. And you wouldn't really want to sponsor an event out of a subcommittee. So where I come down on it is just what Kurt's saying. If it's a formal action of the board that requires a vote, you would always want it to be the full board. And to me, this is the creation of a human services program as defined by that general statute. So I think the safest and probably most prudent way to do it would be to do it as a full board action. And I also agree with Dan. That is the goal of the program is to vet the idea, and then it comes as a motion before the board, and that's where discussion can occur. I agree with Dan. You don't really have to do it again.
Dick, if I could be so bold as to step in, as a member of the Health Committee, as I recall from our meeting earlier, it was unanimous to recommend that this program or this pilot program be implemented. So as a member of the committee, I would have no problem if you, as the chair, bring it to the full board as a motion. Again, since it was a unanimous discussion and consensus, then just seems like we could move forward with the motion.
So should the motion be presented right now or next month?
This could be the first time and I'm glad to see it actually. This may be the first formal motion that's come out of the committee. So I'm actually happy to see this. It shows that our method really is working as we develop it. Kurt, I'm gonna lean on you a little bit as our
I'm
procedure
pulling up
expert.
the procedures as we speak to see if,
Yeah, can the committee bring a motion out of their report, or do they have to wait and schedule it in new business the next month?
and I will let you know that. If you all can hang on, give me a second, I will try to find that answer.
Tony, a practical question I have is, would delaying it for a month also delay the project? Or is this just a procedural delay that has nothing to do with the progress of the project?
Hi, this is Casey from the Health Committee. I just want to say, Martha, from my understanding, talking with Justin and Dr. Shukla, they've done a lot of the background work already to be ready to implement this, I guess, as soon as the approval is in place. So yeah, I think as soon as the approval is done, they anticipate that they can get everything going within a month.
So
Well,
everyone, according to our procedures, that normally anything that you want to place on the agenda has to be submitted to the secretary no later than 2 weeks prior to the next meeting. If you wanted to take this issue up today, I would think that for this specific item, the board could suspend the rules by a majority vote, and then, should they choose, then they could act on the recommendation of the committee. And if they wanted to take that up today, that would be my recommendation. If not, put the item on the agenda for the next board meeting.
So friends, what's your pleasure?
So what I'm hearing Kurt said is that someone needs to make a motion suspending the rules so that we can put the motion for this proposal to a vote.
This is Martha. I move that we suspend that particular rule to enable this to be added to today's agenda.
Is there a second to suspend the rules? Thank you, Linda. All
I'll
those in
second.
favor?
Oh,
Thank you, Dan. We'll get you in a second. All those in favor?
Aye.
Any opposed? All right, so we have suspended the rules in order to vote. Dick, would you be willing to read again what you are proposing? And then after that, I will entertain a motion and a second.
I will try my best.
Okay.
The Public Health Committee unanimously supports Dr. Shukla's proposal for smoking supply distribution for harm reduction. And then we have this would be a 3-month pilot program in Buncombe County with monies that have already been appropriated. And there were 3 points. I hope it's okay that I can include the 3 points. 1,
Please do.
bring equitable access to harm reduction supplies similar to the SSP. 2, obtain metrics that are similar to the SSP so that we could identify how the program is doing over the long term. And 3, to reevaluate the metrics when deemed appropriate and adapt our program as needed.
And so you are asking for the board's support of the committee's recommendation?
Yes, and the recommendation is for those, for the program and the 3 points, to include the 3 points.
Is there a motion and a second?
Doesn't
Thank you, Dave.
doesn't Dick's bringing it from a committee count as the first motion?
I would think so.
Oh, okay,
It just
great.
needs a
So
second.
David, you're a second. All those in favor of supporting the Health Committee's recommendations, please indicate so.
Aye.
Any opposed or abstentions? All right, so thank you so much to the Health Committee for your hard work with Dr. Shukla and moving this exciting program forward. Next, we will hear from Dr. Dan Frayne from the Safety Committee.
All right. That's exciting when we suspend rules. I like that power. I want to suspend rules more.
Dan, I have a job for you.
All right. All right. So the Safety Committee, we had a really wonderful presentation by Rebecca, who is giving us a follow-up summary of what has been happening over the past year and a half of the great work that her team is doing, particularly around the use of data. You know, we've been really hammering in on the importance of collecting data, getting more aggressive and intensive and deeper, particularly around outcomes and measures and splitting things out by race and ethnicity. And so she has been doing a fabulous job at creating new systems and strategies and then utilizing the data to change programmatic and processes. So we got a really great overview of what's been happening. Some of the highlights of what's been happening is that by using data last year, from starting in January, looking through the year through December, particularly around custodial and case logs and times to closure and adjudication, the data from the January standpoint to the December showed dramatic improvements. And she used the data to identify process bottlenecks within the court system and their regular processes and really cut times in half, if not by 90%. In various aspects of the system. So really applauding her team and her efforts. And I will remind everybody that Rebecca has been working understaffed and under-resourced for some time, although she is always humble about that and continuing to make the excellent improvements with the team that she has. So it just highlights the hard work that they're all doing. Another aspect is really solidifying the intentional trauma responsive culture process. And that's the biggest area to reduce disparities. It's has peer support and advisory around how it's going and to improve it. And one of the biggest exciting elements that we heard is that there is a new, and what I hear is a fairly unique, innovative team called the Family Engagement Team that has been hired, and it's 4 people whose sole job is to engage families. They don't carry a caseload within the social work space. They engage families. And so that is a huge win. That's a huge win for Buncombe County. It's a huge win for Rebecca's team. And the fact that it's innovative shows that we are leading in trying to really do things that will make big differences in people's lives. The one thing we did talk about is making sure that that family engagement team is representative of the clients that are served. And that continues to be a struggle. And so we had some conversations about how to think about hiring practices and retention practices for a racially and ethnic diverse team to serve a racially and ethnic diverse client base. So that was important. And she's going to continue to work on that. She's also really made improvements on staff resiliency and safety supports for the team with lots of different resources and active engagement in that space. And then finally, we reviewed the plans for using the racial equity data to drive improvements. So that's in its infancy. We never really had split out data at this level until this year. And so our plan is Rebecca's going to be working on a action steps and a targeted goals. And we expect to hear that by the end of the summer, August or September. So that is it in a nutshell. It was really great. And I just I continue to be in awe of Rebecca's leadership of this team. So thank you, Rebecca. Any other comments from the other committee members?
Thank you, Dan, for the report. And Rebecca, I just want to echo what Dan has said. I am in awe of your leadership, and we are very grateful for you. All right, and so we have Dr. Martha Salyers with the Opportunity Committee.
I'm so glad to talk to everybody this month. We spent our time today mostly focusing on the incredible efforts of the training team in Philip's group. You can imagine that with the constant changes, with all the benefits programs, the federal things, state things, county things, that it gets very confusing and that it's very difficult to train people. And Philip has already talked to the whole board about how long it takes to get staff members adequately trained to do all of these services, especially with things like Medicaid expansion, that little tiny thing that came around the corner. And how Buncombe has addressed that is Heather Ramsey and her team, her training team, they have gone so far as to put up an entire SharePoint that's superbly organized, and they'll give any of us access if we'd like to see it, on not only what the trainings are, and there are many bespoke trainings created by Buncombe County for our specific purposes. They've also invited neighbor counties or partner counties to help with these resources if there are empty spaces in training sessions and online. The state does not have this sort of a training capacity to offer the counties. And up to, Philip helped me, 65 other counties have asked for Buncombe's assistance in creating their own training programs that are appropriate for these staff members. But not only are they providing the training, they're tracking the training by individual and overall, and doing pre-tests, post-tests, and keeping very close track on how people are doing through the training. This is extremely helpful in determining staff retention, both on the front end, the probationary end, and on helping staff feel that they can do their jobs in a way that they want to keep doing them. They want to stick around and keep doing them. They're also working on staff retention and development to see if they can add some portions of the curriculum that are aimed toward people who want to travel further in their Buncombe County journey, for example, supervisor training, leadership training. So this is an incredibly well built out program that's very impressive, and they're working closely with HR and with other programs. So kudos to Heather and her staff and to Philip's whole staff. Are there any questions or comments either from our committee or the rest of the board? Hearing none, I'll just thank Philip and Heather again.
Thank you, Martha and Philip and Heather. Next on our agenda is the annual child fatality and child safety report from Dr. Jennifer Mullendore.
Thank you and good afternoon. So the report was sent out in the packet that Krista shared last week, and I am going to Krista, can I pull my slides up?
Yes, you can. Just share your screen.
Oh, there it is. It's the big green button staring at me. I'm sorry. It's a Friday. It's a Friday. All right. So can I get a thumbs up from Dan or Linda? Because I can see your faces. You can see thank you. Awesome. All right. So as I do every year, it seems for a very long time, I come to you as chair of the Buncombe County Child Fatality Prevention Team, Community Child Protection Team, to cover some key points from our annual report. So now let's see. There we go. So bear with me. If you've seen this before, you're going to get a reminder of what the team is about. So background on the purpose of the North Carolina Child Fatality Prevention System. It is in North Carolina General Statute that this team is to assess, or this system is to assess the records of all deaths of children from birth to age 18 who are North Carolina residents at the time of their death, as well as selected cases in which children are being served by Child Protective Services. And this slide outlines the goals of these record reviews. So the big one that we really focus on is really understanding what children are dying of in our community, identifying gaps and deficiencies in service deliveries, and making and implementing recommendations for either local or state policy and rule changes to help prevent future child abuse, neglect, and death. And so the statute currently divides this work into two teams. One is the Community Child Protection Team, and this team looks at selected active cases of children who are being served by Child Protective Services, and all cases in which a child died as a result of suspected or confirmed abuse or neglect and had a report of abuse or neglect made about that child or their family to DSS in the prior 12 months, or if the child and their family was a recipient of Child Protective Services within the prior 12 months. The other team is the Child Fatality Prevention Team, and this team reviews the records of the children from birth to age 18 who died from a cause other than suspected abuse or neglect. And something that is important to note and that I have to remind media and others about routinely is that fatalities are reviewed during the calendar year following the year of death. So in 2023, we reviewed 2022 fatalities. And unfortunately, over the last several years, because of the number and the complexity of several of our fatalities, our reviews often go into the next year. So our review of 2022 fatalities extended into the first half of this year. And I'm going to share some data from these fatality reviews in a few slides. In most counties, including ours, these two teams are merged into one team. Statute also outlines the role of the HHS board related to the local team. And so one of these roles is to get the annual report from the team. The second is to advocate for any system improvements or needed resources, if there are any, or if the team requests any. And then the third is to appoint members to the local team as designated by statute. Your current representative is Jacqueline Hallam. And then the board appoints the healthcare providers to the team. And so we've appointed Dr. Dina Lashley, a child abuse pediatrician, and Dr. Carol Colson, who's a OBGYN, and a long, long time ago you appointed me. And so team membership is outlined in the report that I sent out. So now we're going to dive into some data. All right, so first, we're just going to look at the number of child fatalities by cause of death in Buncombe County in 2022. So the team reviewed the deaths of 24 children who resided in Buncombe County at the time of their death in 2022. There are an additional 5 fatalities that occurred in 2022 that were not yet reviewed, have not yet been reviewed by the team, and that's based on guidance from the state Child Fatality Prevention Team Program Coordinator. 4 of those 5 fatalities are currently in a pending status in the North Carolina Medical Examiner System, meaning that the documents that system provides, autopsy and toxicology reports, are not yet available. And so once those are released by the Office of the Chief Medical Examiner, then the state program coordinator will let us know, and our team will review those 4 fatalities. There's also an additional fatality that is awaiting an intensive review. This is, again, this goes back to the CCPT role. So this is a fatality of a child who was involved with CPS during the 12 months prior to their death. So that is an intensive review led by a North Carolina DSS team lead, who it's a 2-day, very intensive review. That review was canceled earlier this year due to an inability to fully staff it, and that state DSS worker apparently took a different job, and we're still waiting on the state to reschedule that. I did talk about this with our state CFPT program coordinator, and she said, go ahead and review it as a team. So that'll be on one of our upcoming agendas. I will say I did include those 5 deaths that we didn't review. That data is included in these slides and in the report, because we do get demographic data, we do get cause of death data from the State Center for Health Statistics. And I was trying to be as thorough as possible. And 3 of those unreviewed deaths were accidents. 1 was a suicide and 1 was a homicide. So they are accounted here. You can see from this slide that the predominant causes of fatalities in 2022 in children in Buncombe were illnesses, accidents, and perinatal conditions. I will point out that a significant note, as we discussed last year, suicide was the 4th leading cause of death in Buncombe County children in 2022. And also significant, but not explicitly shown on this slide because it's not an official cause of death, 3 children in Buncombe County died in 2022 as a result of maltreatment and or neglect. And so those are very concerning. The accident spanned the gamut. We did have 2 drowning deaths, and you might have heard the CDC recently released a report saying that drowning deaths have increased in the United States since 2019. And that has played out in recently released child fatality data from the state. 2 accidental poisonings involving fentanyl, unfortunately, are in that category as well. A motor vehicle crash, and also an accidental fatal handgun injury due to an unsecured firearm, which we'll talk about more later. And the fatalities due to perinatal conditions mostly involved premature births. And then, as I feel like I say every year, the sudden unexplained infant deaths, those were categorized as undetermined cause, but they did involve unsafe sleep environments. I wanted to share some trend data on youth suicide in Buncombe County over the last several years, since this, again, has been something that was a significant change in 2022. So this is data from the State Center for Health Statistics. And so we can see that prior to 2022, there were 4 Buncombe County youth who died by suicide from 2016 to 2021. And then we had that big increase in 2022 that unfortunately carried over into 2023 as well. So we have received the first 6 months, the first 2 quarters of 2023 fatality documents from the state for us to review. And so that's what I've included here. As you can see, again, we've had 3 reported to us for the first 6 months of 2023. And these deaths have been in youth, from age 12 to 17. Every death that we review is tragic and devastating to review. But these have been very hard for the team because they have just come one after the other. And reading about these children and families, and just imagining, as many of us are parents, and imagining, it's hard. They're very hard. So I commend the team for continuing to show up despite the difficult work we do.
Hey, Jenny.
Yeah.
This is just Buncombe County, right? Because we also know that Henderson County also had, and so this in a community, we're kind of very close to each other. It seems like it might also be helpful just to kind of look at that in aggregate. I don't know if you ever do that, but
I don't have access to their.
We're all in this together, and this doesn't even tell the whole story of what's going on in our community.
You're totally right. Yeah, and that's the thing. And we're a Buncombe County team. We get Buncombe County data. We don't do a lot regionally. It's just because I think we're all so busy doing our own team work. There have been summits in the past, statewide summits, and we have asked for data from other counties. This is always I'd say a work in progress, and we have a really great state coordinator. And I do know the chair of the team in Henderson County. And so, maybe that is something that we can sort of collaborate on, is to get a more regional picture. So thank you for that idea.
Can I ask a question?
Yes, Dick.
I don't know if you were going to get into it. But I was wondering if these were due to guns.
Yeah, thank you. That is my next thing to talk about, is that the most common method has been hanging, actually, followed by, there have been some related to unsecured firearms, and then intentional poisoning, but majority have been hanging deaths. All right. The next slide looks at the number of child fatalities by age. And so we see that 41% of the fatalities, so 12 out of the 29, were in children less than a year of age. And that's not surprising. Infants routinely comprise the largest proportion of child deaths, whether you look at it at the county, state, nation, or really worldwide. And then when we dig into the cause of death for these infants, again, not surprising, perinatal conditions were the leading cause of death, which again is consistent with what's seen for the state and the country. And as I mentioned before, I also wanted to include some trend data related to unsafe sleep. So this has been a long-standing issue. And as you can see, at least one fatality a year related to unsafe sleep. And I would say that what we've seen for the last several years is that co-sleeping has been the predominant risk factor. So sharing an adult bed, so adults and children, babies in the same bed, that has been the predominant risk factor in these recent years. The next slide looks at race and ethnicity of these fatalities. And so hopefully, so the darker blue is the non-infant, so ages 1 to 18, and the lighter blue is less than 1. And so, again, just knowing that Buncombe County is predominantly a white, has predominantly a white population, you can kind of just look at this and recognize that these fatalities are disproportionately impacting the Black population of Buncombe County. And then when we look specifically at infant mortality, the state determines this infant mortality disparity ratio, which looks at infant mortality rates of non-Hispanic whites and non-Hispanic Blacks. And because numbers are very small, they look at this in 5-year increments. And so from 2018 to 2022 is the current data that we have. And I included what the North Carolina disparity ratio is, and then what our county disparity ratio is. And you may recall, if you were on the board last year, that I said that starting with 2021 data, the North Carolina Center for Health Statistics added a multi-race category for deaths. And so they basically said, hey, now that we've changed the categories, you can't go back and compare, you can't compare this data moving forward or from 2021 on with old data because we have different categorizations. And the other thing was last year, for the 2017 to 2021 5-year period, the number of Black infant deaths was less than 10. And that data, because of that small number, the data was considered unstable and we were told to interpret it with caution. And so I can't really confidently look at a trend, I would say, between last year and this. It's only 2 points, but we look at last year's disparity ratio because it wasn't calculated by the state. I mean, I did a crude estimate, again, knowing that it has to be interpreted with caution, and that value last year was 2.2. And so we're at 2.36 for this 5-year period. So I would just summarize that by saying it hasn't really changed. The disparity is fairly stable here with essentially Black babies dying more than 2 times. They're more than 2 times likely to die before their first birthday than white infants. And this, for many of you who've been around for a while, you know that this is something that has been going on for a while. And is not anything we want. And so efforts focused on Black infant and maternal health, efforts focused on social determinants of health, efforts focused on racism, all need to continue to impact this disparity. And so when we review these deaths, we're tasked with determining if there was a system problem that like a gap in service delivery or a lack of resources or a lack of education that led to the fatality, and whether there are recommendations that we would make to address that problem and prevent future similar deaths. And so that report that I sent out, or that Krista sent out, has details on all these recommendations. I just wanted to share a few here. So deaths from safe sleep, again, not anything new to us. And so work that has been ongoing. We partner with Safe Sleep North Carolina. They have updated some videos. Some are very brief. Well, they're all very brief videos that address safe sleep and answer questions that parents may have. And so we've shared those videos or links to those videos with local pediatric care providers, with community partners, hoping that those get out to caregivers and parents so that they reduce the risk of having to suffer one of these tragic deaths of their infants. We continue to reach out to Safe Sleep NC and just really encourage them to continue to review the literature and research and look for promising or best practices that can actually lead to behavior change. Because what we often find is that parents and caregivers were educated, they had a pack and play or a bassinet or a crib, but they didn't actually implement that education or use that equipment. And so how can we change behavior? And so, excuse me. So encouraging Safe Sleep NC to continue to work to move people in that direction. And then we also get funds from the state every year to use for whatever we deem useful. And so we used our state funding for fiscal year 23 to purchase pack and plays and fitted sheets. And we gave those to Sisters Caring for Sisters, local community-based doula program founded by Women of Color for Women of Color, and then also to our Nurse Family Partnership Program here at the county. Addressing unsecured firearms. So unsecured firearms, like I mentioned earlier, have been involved with accidental deaths and with suicides that our team has reviewed. Last year, the state rolled out NC Safe, Secure All Firearms Effectively. And so our CFPT sponsored and was a part of a, essentially it was like a press release, press gathering. And this year, there's actually going to be a gun safety event on Friday, June 7th at Pack Square Park. So we encourage all of you who are able to come and join. There'll be a group photo. People are encouraged to wear orange. So group photo at 12:45, and then an event from 2 to 6, where there's going to be youth-friendly activities, music, speakers, gun locks, really encouraging people to lock up and secure their firearms to keep children in our community safe. And then addressing youth suicide. So as many of you know, last year, so in May of 2023, our team sponsored a youth suicide prevention community conversation, pulled together representatives from a variety of community agencies that serve youth, had a great conversation, and generated lots of ideas for education and training. I would just say work continues on those on the ideas generated at that session. And this year for our fiscal year $24, this is not going to be the greatest screenshot ever, but we are giving that money to our county's CAPE team, the Community and Public Engagement team, to print signs and magnets promoting the 988 Suicide and Crisis Lifeline. To continue to support this work. And I did want to, this is in the report that you have, but I did want to pull this out, this particular recommendation, because it has been something that the team has brought up multiple times, that, you know, we had this summit in May of 23, lots of ideas were generated, but we lack a leader. We lack a coordinator of this effort, someone who's like dedicated to that. And so the team did make a recommendation that the county government should fund a part-time 20-hour per week position dedicated to that, dedicated to leading, coordinating youth mental health and suicide prevention efforts in Buncombe County. Unfortunately, budgetary issues did not lead to this position being funded. And so the work continues. Victoria Reichard, who might be on this meeting, you know, has been doing all she can to move this work forward and help coordinate recent updates. Like we just found out, VIA was recently awarded a $5,000 system of care grant to support work of the Buncombe County Child Collaborative, who it sounds like may sort of take on this sort of leadership coordination role at this time. And so they're going to work on bringing awareness to protective factors and building resilient communities with the goal of decreasing mental health issues that lead to youth suicide. And there is an upcoming statewide summit on suicide prevention that members of this collaborative and other stakeholders, including some public health and social work staff, will be attending. I think that's—
Can I ask a question?
Who's that, Dick? Yeah.
Yeah, I might be a slide or two behind, but
Oh, you're fine.
Are there going to be any politician or public health leaders at that Pack Square Gun Awareness Day?
Ellis, Stoney, do you know?
I know myself, I plan on attending.
Any politicians? Any politicians?
I'm not sure. Yeah, I'm not sure of any, but I'll be there too.
You can invite them, Dick.
Well, I'm just saying, a lot of this is,
Yeah.
an executive order or it's a law. And, if you have lawmakers or potential lawmakers who are actually in favor of gun locks as opposed to some politicians who are against them, but maybe maybe who knows? They need to be educated.
Yeah. And what I'll say, like what kind of hit me, I don't know, it wasn't earth shattering, but when we were reviewing these deaths, just like I talked about with unsafe sleep, people have the education, people have the tools, they just don't implement. And it's the same thing with firearm safety. You might know as a firearm owner, I need to not leave my gun loaded and unlocked and unsecured. And you might have a gun lock. But are you actually taking the behaviors, taking the steps to implement that? That's what we're finding is, some people aren't. And so how that behavior change, any of us who work in health and human services know behavior change is like, wow, hard, right? It's hard personally, we can all relate. And so, it's just these are very difficult problems sometimes to solve. Cultural changes and beliefs have a significant role as well. So
thank you.
And Dick, I would say too that this Safe Firearm Initiative really generated last year out of the governor's office, and I think it also had a real strong support from the Attorney General's office. I do believe that our local commission will be invited to the event, and I can make the recommendation to the planning team that our local legislative delegates all be invited to the event as well.
I think they need the opportunity to decide whether they want to support it or not. And it's an event, I think, that if they support it, I think that would be quite favorable.
I would like to point out that one of the things that the schools are doing, at least Buncombe County Schools is doing around prevention is in two of our high schools, we're using an evidence-based model from the University of North Carolina, Chapel Hill, called Sources of Strength. It's a peer support model. So you identify about 50 to 60 kids and some teacher sponsors, and you do some extensive training and how to support your peers, how to ask the right questions, how to get them help to someone, get them to someone for help. And it's a pretty active group in both in Reynolds High School and Irvin High School. So and they're growing in their support over time. So we're excited about that and see if that has any impact.
Yeah, Shannon Martin's the Buncombe County Schools rep, and she is such a strong advocate. And the school systems are doing amazing work and really working hard on this. And they just talk about like they need more. It's not just a school problem. It needs to be a community-wide effort.
Exactly. But the kids are actually taking the leadership of this. They own the program.
Great.
And I've met with some of them on some other things, and they are actively coming up with their own ideas, which are fabulous.
Dan, I see your hand.
I just want to just put another plug in for cross-county collaboration on this, on some of these issues. I think we need to move beyond the county line when it comes to youth suicide and whatnot. And I've been disappointed at some of the barriers that seem to be deep ingrained in either the political will or the school systems or the lack of desire to work, across county lines. And I think Henderson County did a really huge effort that was the whole community was engaged. They had Advent Health engaged as a hospital, kind of healthcare partner. They had the health department, they had the school system, and they had the entire faith community all engaged around a single kind of process and thought of education and resources. And they had over 1,200 youth at an event for the community. Very powerful, and there was very little that seemed to be little engagement from Buncombe County when the desires were say, hey, you want to do this together? And so I just want to just put that plug out, is that we got to think a little differently. I know Buncombe County is different than Henderson County. I know that Asheville City Schools, Asheville Schools and Buncombe County Schools is a lot bigger and different. I know our Department of Public Health is different, it's bigger. But I think we're missing opportunity if we're not thinking about community that is broader than just ourselves around this issue in particular.
Are there any other questions for Dr. Mullendorf? Thank you for your presentation, Jenny. We appreciate you.
Thank you.
All right. So it appears that we don't have any old business, so we are moving on to new business. The first item is the nomination of, pardon me, a new board member. And last week, the executive committee met with Mr. Mark Brooks, who would be filling the position of engineer that is mandated for our board. Mark has familiarity with the health department related to submitting permits in his role as an engineer. He has expertise in regional, local environmental health departments related to the permitting of wells and septic systems. He formerly served on the North Carolina On-Site Wastewater Contract Inspector Certification Board. And he currently works for, I think the company is CDS. He had been in his own practice and merged with the other practice recently. Other members of exec, if there's anything else you want to add about Mark Brooks and our nomination of him? Okay. Well, we have to, the exec committee is presenting the nomination of Mark Brooks as the engineer on our board. All those in favor? Oh, we need a second, sorry. Thank you so much, Leanne. All those in favor, please indicate so.
Aye.
Any opposed? Any abstentions? All right, great. We will happily welcome Mark to our next board meeting in June. And then our second piece of new business is related to the letter regarding the safety of the Health and Human Services building here on 40 Cox Avenue. I say here because I am here at 40 Cox Avenue. And this letter was sent to you, the draft was sent to you earlier this week. And I would like to open the floor for discussion of revisions or any additions we want to make.
I think you wrote a fabulous letter.
Thank you. Stoney, is there anything you want to add
No, I would agree. I think the letter's very descriptive, and I think it's a very fine letter, and I appreciate the board taking the interest, in the safety and security of our staff and visitors. So I just feel gratitude, basically.
I have one word editorial change recommendation.
Absolutely. Yes.
If
go
I
ahead.
may. Sorry. The last second to last sentence where it says we assert that the safety and security of our staff and customers is one that cannot be delayed. I would just, for some reason, the word cannot doesn't set with me. And I would suggest to say that one that should not be delayed, because it certainly can be delayed. It's possible, but we don't think that it should. That's just my opinion.
Thanks for that, Dan. All right, so this, Stoney, again, this letter is coming from exec.
Well, it would be coming actually from you
Oh,
on
coming.
behalf of the full board.
Okay.
I would see it.
So we need to vote? Okay, do we need a second? Do we need a motion?
I mean, a motion and a
All right, is there a motion and a second to accept the draft letter to the commissioners regarding safety concerns at the HHS building going forward?
This is Linda. I so move.
Thank you, Linda.
I'll second.
Thank you, Dan. All those in favor, please indicate so. Any opposed? Any abstentions? All right, so I will make the amendment and we will send this letter out hopefully today. Thank you all. All right, Stoney, director's report.
Yes.
And I'm very sad.
Me too.
And Krista is too. But very happy for the next chapter that awaits you.
Oh, thank you. I just have one brief shout out to give to several board members, and I had a picture, but I'm having the hardest time getting it up. I'll send the picture out to the board by email. But we had, as a part of our organizational care model, Public Health hosted a Public Health Field Day this week on Tuesday, and it was a wonderful event. I first give kudos to Ellis and her organizational care team for planning a really great resiliency event for staff. I didn't count how many, but it looked like probably 110 or so public health staff attended, which is a vast majority of our whole division. But I also want to give a shout out to board members who showed up to serve food at that event. So Dr. Needleman and Dr. Lima and Linda Weldon showed up and served barbecue and slaw and other food to staff for quite a while, and I just wanted to express my appreciation to their support to the staff. I know it meant a lot to them to see board members there serving them, so I just wanted to give that shout out to the whole board while we were all together. And then I also want to introduce Sybil Tate to you. Sybil Tate is one of our 3 assistant county managers. Some of you may have met Sybil, some of you may have not had that pleasure yet. But in July, we've added a 3rd assistant manager who will come on board officially in July. The hire's been made. It's Tim Love, who is our Intergovernmental Affairs Director right now in the county. Wonderful choice as county assistant manager. And then because of that, the 3 assistant managers will shift their portfolios a little bit to right-size them and also to move around some just so that they get that experience and we get to move around between assistant managers. So effective July 1st, Health and Human Services will be one of the departments that sits under Sybil's portfolio. So I wanted you to be able to meet her and she'd be able to address the board, and she may also have a little bit of information to share about the selection and recruitment process for the new HHS director. So Sybil, I will turn it over to you.
Thank you, Stony. Yes, everybody, I'm Sybil Tate. So nice to meet you. I would say I enjoy participating in my first board meeting with HHS, but Dr. Mullendorf's segment was really hard, as it is every year, to hear that data. So that's not, enjoyed is not the right word. But I'm glad to be here and I'm excited to work with you all. It's a new adventure for me and I really am looking forward to it. And with that in mind, I wanted to congratulate Stony as well and say that I'm really happy for him. But we are going to miss him dearly. He has been a major asset to the county, and I'm sure you all have enjoyed working with him in your role as board members. And I wanted to share with you too that I know we're all anxious about him leaving, and so I wanted to let you know that from the manager's office, we're working on a memo that will be sent to you all, and it will outline the application process, the interviewing process, and give you the full rundown on what that is going to look like and the timeline as well. So we're working to get that memo shaped up and sent to you all as soon as we can, hopefully in the next week or two. And I did want to let you know that we would love to have you all participate in that process, in particular, the chairperson, and then possibly up to 2 other folks. So I'll let you all think on that, and we'll get back to you with details about what that will look like. So thank you all for having me. And I really look forward to working with you and look for your knowledge and input on this selection process. So thank you.
Thank you, Sybil. Will the memo also outline the interim process?
Yes, we will
Okay.
speak to the interim. Yes.
Wonderful. Thank you. All right. Moving forward with our agenda, I have my chairperson's report, and I have 2 items. One is sad, one is exciting, and I'll begin with the sad. Stephanie Bostick, who joined our board just in December, is resigning from the board because she is moving out of state. And so I hope we can all wish her well, and I just want to state how much I've appreciated her perspective on the board. Stephanie is not fulfilling one of our mandated positions, so that with the recommendation approved for Mark Brooks and with Casey joining us today, that takes us now back up to a 19-member board. And we want to maintain that for the time being, particularly as we are preparing for the departmental transitions that are coming up. So the exciting news, and I think all of you have gotten an email about this, I am calling this, Ellis, I hope you don't mind, I'm calling this the Health Mobile, but our mobile health unit will have its ribbon cutting at Carrier Park on, is it the 10th? 13th. On June 13th at 1:30 p.m. And we have all been invited to the ribbon cutting. And prior to that, the same day, is the World Elder Abuse Day walk that will also take place at Carrier Park. So I know that the administration here at HHS, and Ellis in particular, is very excited to have the mobile unit up and running. And Ellis, I don't know if you want to say a few words about the unit or about the ribbon cutting?
I'll just say that I do hope that everybody can join us. It will just be a nice opportunity to show it off to not only you all, but to the rest of the community. As we have, it just brings more access to our community. Like I like to think of it as we're moving the front door, moving that front door from 40 Cox really out into the community, bringing services to where people need it, where they live, work, and play. And so I hope you all can be there to join us. Because while, yes, the actual vehicle is important, but it's really about the work that is being done regardless of the actual vehicle. And so I'm really proud of this public health outreach team and the mobile services that we're offering. So I appreciate all y'all's support. Thank you.
Great. Well, if there is no other business, unless someone has anything that they want to bring forward, I will entertain a motion and a second to adjourn. Thank you, Johnny. Thank you, Leanne. All those in favor, please indicate so.
Aye. Aye.
Aye.
Great, and we will see you for our virtual meeting in June.